like to reintroduce Dr. Ron Reimer, who's a neurosurgeon at Mayo Clinic, Florida. In fact, he's one of the two founders of the Department of Neurosurgery in Florida at Mayo Clinic, and has built a very large, vibrant department, started a neurosurgery residency, and although Ron can do pretty much anything neurosurgically, I've discovered he's one of my go-to guys for brain tumors. He has specialty training in stereotactic radiosurgery, in orbital surgery, and more recently he's become interested in the medical uses of acupuncture, particularly in surgical patients, and that's what he's going to talk to us about today, that and some other integrative techniques.
Thank you very much, Julie, for that introduction. And over the course of yesterday and today, we've already heard about some absolutely phenomenal advances in neuro-oncology and rehabilitation and retraining the brain. And I also myself have a passion for integrating Eastern and Western medicine and things that have been learned over thousands of years. So it's an old art and science, but now we're considering it a new application in our world of advanced neurosurgery. So I'd like to help provide the key points on how we integrate acupuncture and other forms of integrative care into our practice. So by means of introduction, TCM, or traditional Chinese medicine, looks at the circulation of energy or qi throughout the system, which is a continuous flow anterior to posterior, and everything is in yin and yang methodology. And similar to the spinal cord injury patient, when there's blockage for whatever reason, whether it's mechanical, traumatic, vascular, there is the resultant illness due to this, and acupuncture is a very powerful way to mobilize that block of qi. We've learned that on the left are points, acupuncture points, of which there are a total of about 4,000 that have to be studied and integrated in different ways through the meridian circuits. Comparing that to trigger points, which have been defined by Travell and Simmons in the physiatry world over the last 200 years or so, there's about a 65 to 70% overlap between those points, which I find very interesting. I have particular interest in a sub-specialty of acupuncture, neuroanatomic acupuncture, where many of the active points that I use in my treatments are those that are overlying nerves. For instance, in the right panel, on the bladder meridian, many points are overlying branches of the sciatic nerve, perineal tibial nerve, and on the other panel, points that are effective in the ocular and visual system overlie branches of the superficial perineal nerve. It's a whole different mindset, and you really have to think out of the box.